Hello, my name is Natasha Santos, and in this video I'm going to talk about emphysematous cystitis. The video will be available on YouTube, Facebook, and Twitter. Emphysematous cystitis is a rare disease characterized by the presence of gas in the bladder wall or lumen, caused by a bacteria or fungi. The primary risk factor is diabetes. Emphysematous cystitis is caused by E. coli or other types of bacteria like Klebsiella or Proteus.
Cystitis, also known as the inferior urinary tract infection, is the inflammation of the bladder. Cystitis is more common in women because women's urethra is shorter than men's urethra and it is closer to the anus. The urethra is the last tubular structure of the urinary tract that conducts the urine from the bladder to the outside of the body. Women's urethra is about 4 centimeters long. Men's urethra is about 15 to 25 centimeters long. The most common cause of acute cystitis is bacterial infection, in many cases caused by a bacterium called Escherichia coli. Normally, the urinary tract is sterile. Sometimes bacteria from the skin can get into the urethra and migrate back up the urinary tract, causing urinary tract infections. The most important contributing factors are constipation, sex, low fluid intake, cold. Clinical symptoms include pollakiuria, which is an abnormally frequent urination, dysuria, which is pain or a burning sensation during urination, pain in the inferior abdominal region, cloudy urine, hematuria, meaning blood in urine, but this symptom is rare in cystitis. Fever is not a common symptom for cystitis. Your doctor might indicate a urine culture, which is a test that identifies the bacteria that caused cystitis. It is very important not to take any antibiotics before the urine culture, as this may lead to false negative results. This is how you should collect a urine sample. First, wash your hands and then your genitalia. Then collect some midstream urine, approximately half full of the sterile container that you will receive, and take it to the laboratory analysis. The urine culture is usually associated with susceptibility testing to see which antibiotics will inhibit the development of the bacteria causing the infection. The result of urine culture is normally ready in 2 to 3 days. Because in these 2 or 3 days it is not known for sure which are the bacteria that cause the infection nor the right antibiotic, the doctor will indicate empirical treatment. Empirical treatment is the treatment prescribed before the definitive diagnosis is established based on doctor's medical observation and experience. After the result is ready, the doctor will indicate the most appropriate antibiotic for the infection. In some cases, the infection may progress with spontaneous healing. Most of urinary tract infections can be easily treated if they are addressed in time. If not addressed in time, complications may occur, such as the spread of the infection to the kidneys. This is why early diagnosis and treatment are so important.
With cystitis, cyst refers to the bladder, and itis refers to inflammation. Therefore, cystitis describes an inflamed bladder, which is usually the result of a bacterial infection, but also can result from fungal infections, chemical irritants, foreign bodies like kidney stones, as well as trauma.
Applications in medicine. Even when caught early, aggressive treatment is required. Antibiotics are proven to cure emphysematous cystitis over time and reduce the amount of gas inside the bladder wall. Prognosis is poor if antibiotics are not used to treat the patient. Additional treatment consists of urinary drainage and good control of blood glucose. The treatment of underlying comorbid diseases, such as diabetes, is extremely important because they can intensify the infection.
Cystitis, or inflammation of the bladder and the urethra, that's the tube that your wee comes out of, is caused by a bacterial infection. Germs that normally live harmlessly either in your bowel or on the outside of your vagina can pass up that tube, which is much shorter in women than it is in men, and get into the bladder where they can multiply, leading to symptoms. It's more common if you get dehydrated. It's more common after sex because of all that rubbing around, and it's more common in women who've gone through the menopause because the vagina and the tissues around it can get dry, making it easier for germs to penetrate.
Pros and cons. Pros. The disease is treatable. The radiographic findings provide the first and only diagnostic clue. Abdominal and pelvic CT scan further delineate the extent of the disease. Cons. Emphysematous cystitis requires aggressive treatment with parenteral antibiotics and bladder drainage. Delayed diagnosis may lead to unfavorable outcomes including overwhelming infection, extension to the ureters and renal parenchyma, bladder rupture, and death. Issue applied in Ecuador. In Ecuador, emphysematous cystitis is not that common. According to the INEC, in 2029, urinary tract infections represent 10.3% of diseases in women. The disease most commonly affects elderly diabetic and immunocompromised patients. To date, there are scarce publications in international literature and none at the national level regarding this disease. In Hospital Teodoro Maldonado, there are about 49 cases so far.
Cystitis is defined by specialists as an inflammation of the bladder caused by a bacterial infection. If not treated in time, cystitis can become irritating and painful enough to become a serious health problem. In addition, untreated, it can seriously affect important organs in the body, such as the kidneys. In this On Salus Health video, we'll be listing the best cystitis over-the-counter medication in order for you to treat this inflammation accordingly. Ciprofloxacin is one of the most commonly used antibiotics to treat cystitis. However, it does require a medical prescription. Cipro, for short, is usually prescribed by a doctor to treat UTI problems, generally at a dose of 250 to 500 milligrams every 12 hours. It is applied in women for 3 days and in men for 7 days. Nitrofurantoin is another commonly used drug to treat cystitis. Commercially known under the name of furantoin or macrodantin, nitrofurantoin can be used in children older than 12 years old and adults in a dose of 100 milligrams every 12 hours for 5 to 7 days. This drug is known for having a low rate of side effects. However, if they do appear, they may be recognized as nausea, diarrhea, abdominal pain, and loss of appetite. Dimethoprim sulfur is an over-the-counter drug that fights against certain bacteria. This drug acts by stopping bacterial growth through the bacteriostatic mechanism. The recommended dose for cystitis is a tablet of 800 milligrams of sulfamethoxazole and 160 milligrams of trimethoprim every 12 hours for 3 consecutive days. Flavoxate accelerates the cystitis healing process and prevents worsening of the symptoms. Flavoxate acts as an anti-inflammatory, analgesic, and antispasmodic of the urinary tract and the bladder, similar to that of ibuprofen. However, flavoxate has a minimal action as a bactericide. Its recommended dose is 1 tablet every 8 hours. In addition to the above-mentioned medications, high doses of vitamin C or absorbic acid, which holds natural urinary acidifiers, create a space which is not suitable for bacterial growth. The recommended dose of vitamin C is 1 gram every 12 hours, which does not require a prescription. If you cannot find vitamin C, you can opt for the consumption of citrus fruits such as oranges or lemons, which have the same components. And that's it for our On Salus Health video about cystitis treatment. For any doubts or questions, post them into our comment section below. And if you found this video helpful, give us a like and subscribe to our channel for more. We'll see you next time.
Conclusions. Emphysematous cystitis is defined as the presence of gas at the level of the bladder wall of infection cause, which may or may not have associated intraluminal gas. The pathogenesis of this disease is unknown, probably due to multifactorial mechanism. The clinic of this disease is non-specific, so the diagnosis is mainly through imaging tests, mainly CT. Treatment consists of adequate glycemic control, intravenous antibiotics, and bladder drainage. The prognosis is generally good. Thank you very much.